Hello everyone. Just as a reminder for active members, for credits towards LMHF Wellness Program Part 2, you must watch the video in its entirety and comment on each video with your name. Once confirmed by LMHF, your comments and name will promptly be removed. So hello everyone, my name is Kelly Cardamone. Just a brief background. I am a registered dietitian. I have a degree in exercise science. I'm an ACSM certified exercise physiologist. I'm a certified diabetes care and education specialist. I am also integrative and functional nutrition certified practitioner and a certified wellness coach. I have been in the industry for about 25 years and truly do love what I do. And I just started working on my doctorate in clinical nutrition. So the topic today is food and your mood. And there is a lot to cover, so I'm going to really just be touching on a lot of things that impact your mood. And this is probably one of my favorite lectures because it really reinforces the point that you are what you eat. And it is really important for mood enhancing. It has been really difficult this past year with everybody and COVID, and our lives have changed. For some people, they have embraced this time to focus on themselves, and they have been eating healthier and cooking more and eating out less. And for others, unfortunately, it has caused them more stress and to cause them to stress eat. So I have had my patients or clients on two different ends of the spectrum. So we're going to kind of talk about sleep, exercises, endorphins, how exercise impacts emotional eating, things that impact your mental health, what foods impact your mood, and then I'll just talk a little bit about the dietary supplements. I'll touch on them just briefly. So the brain, I think we take that brain for granted, but it regulates everything that you do. Respiration, sleep, digestion, everything. It directs our thoughts, our emotions, our actions. This tremendous workload, believe it or not, utilizes about 20% of the entire energy supply from the body. So it needs a lot of energy. So what you feed it is going to impact how that brain functions. And where does this energy come from? What influences our food choices? So to just go over some mental health stats, that 1 in 4 adults, 25% of Americans have a mental illness. 6.7% of Americans have major depression, 1 in 10 take antidepressants, and 18% of Americans have anxiety disorders. Sleep, stress, and diet all impact your mood. And the reason I really focus on diet part is because when you don't eat well, you don't usually sleep well. And so really everything is connected. As you can see here, your stress, your sleep, and your diet all will impact your mental health. And sometimes by just changing one, it really kind of will spark changes in the other areas to make you feel better. So just to touch on the importance of sleep, I'm sure we all know this. I actually will tell you that probably half of my patients that I see in an outpatient clinic, and I work a lot with diabetes as well, they don't sleep well at all. And a lot of them have sleep apnea, which we'll talk about as well. They don't necessarily use their CPAP. Sleep is essential because when you don't sleep well, you don't feel good. It impacts your mood. That after a sleepless night, we've all been there. You're irritable, short temper. You're more vulnerable to stress. Studies have shown that even sleep deprivation has significant effect on mood as well. They go out, some of the studies they've done take hour by hour, that's showing that every hour that you're sleep deprived, how it impacts your cognitive function. And again, we've all been there. How many of you have had not good night's sleep for quite some time and you can't remember things? You're not doing things properly, let's say, because of that cognition. You can't focus. It also can cause hormone disruption. We do know that when someone has sleep apnea, that it impacts diabetes. It will actually raise your blood glucose levels, and it can significantly, especially if someone does not use their CPAP machine. But it also causes you, to put it very simply, you crave carbohydrates when you go through not having a good night's sleep or you're sleep deprived. Usually when you're tired like that, because it increases that cortisol level, your body does not crave chicken and salad. Instead, it's craving sugary products. So sleep loss can lead to impairments in that glucose metabolism and increased insulin levels. So basically it also increases or impacts insulin resistance. So sleep can impact diabetes, prediabetes, but also we know that it can lead to obesity and make weight loss more challenging. I have patients that come in and they want to focus on losing weight, but they literally are sleeping 2 hours per night. And I tell them that it is going to be very difficult to achieve that goal unless they talk to their physician, or I work with a physician as well, and we try to get them on some sort of sleep hygiene plan that is going to benefit their health and help them sleep better so they feel better. And again, in people with diabetes, it can significantly impact your fasting blood glucose levels. So how do you improve sleep? You're aiming for about 7 to 9 hours a night. They say that that is ideal. It's not so much the quantity, but it really is the quality. You can be in bed for 10 hours and maybe only get 5 to 6 hours of sleep. I really like individuals to wear their Apple Watch, a Fitbit, Garmin. Those are great gifts, or something just to gift to yourself. I tell everybody you can't put a price on your health, because it's a motivator to move more and to get your steps in and to exercise. But a lot of the activity trackers now, I actually have the Whoop strap, which is great. It looks at strain on the body and it tells me heart rate, but they tell you your sleep and the quality of sleep. And that's why I really tell my patients and clients to use them. Turn the TV off 30 to 60 minutes before bed. We do know that the light that comes from the TV, that blue light, impacts melatonin release. So the electronics, you need to make sure to shut them off. Do not eat or drink 2 hours before bed. A lot of people like to eat right up until they go to bed, and it can disrupt your sleep. Comfortable clothes, keep the room cooler. You actually will sleep sleep better in a colder room than something that's too warm. And again, these are just really simple, basic things. There's a lot more that you can do. But meditation, music, I sleep with a noise machine. I love weighted blankets for individuals, especially if you have anxiety issues. That weighted blanket has been shown to calm down the nervous system. And by the way, when you purchase the weighted blankets, make sure to take note of your weight, because there's specific weighted blankets, a specific weight based on your current weight. So, sleep is going to help improve your mood. It's going to also improve, as I had said, how your body utilizes glucose and looking at insulin levels, right? So now it's sleep and then stress. Research has shown that stress in general, by the way, does not impact your appetite. So I have a lot of people that will say, I think stress makes me eat more. Stress in general has not been shown to necessarily cause you to eat more food. A lot of individuals, when they are stressed, don't have an appetite at all. What they have found, though, is that if you are an emotional eater, so if you are somebody that is an emotional eater, you will tend to crave more sweet, high-fat foods, energy-dense meals than an unstressed and non-emotional eater. So what that basically is saying, if you are not a stress eater, you're probably not going to land up eating more under periods of stress. You probably will not make healthy choices, because when we're stressed, a lot of times we don't take care of ourselves, unfortunately. It's too much work to cook and grocery shop and things like that. However, if you are an emotional eater, you really do want to take note that when you are under stress, you are probably going to be the individuals that's going to grab the cookies and the cake and the candy because it makes you feel better. And a lot of that too is a control issue, right? It's something you have control over, and I tell everybody, unfortunately, it's fleeting feelings of goodness, right? It's just that moment while you're eating that food, and then you want to continuously keep that up, so that's why you continually eat that whole bag of chips and that bag of cookies. 57% of overweight adults self-report frequent emotional eating. It is something that I ask my clients when I work with them is, are you an emotional, bored, or stress eater? And I will tell you statistically from my practice, half of my clients' patients they say yes to at least one, or if not all of them. And if I ask what they crave, I have yet to hear somebody say salad and chicken. Some people will say anything that's in the house, any kind of food, or it could be sweets, or again, salty, chips, crunchy stuff. 27% say it's a habit. Stress can cause emotional eating, which impacts your mood. So, you don't sleep well. Not sleeping well is a stressor on the body. And that doesn't include all the other stressors in your life, right? Work, family, maybe there's health issues, caring for a sick loved one. There's a lot of things that can cause stress. So now if you're not sleeping well on top of it, that stress just keeps building up. And unfortunately, as I said, when we're stressed, a lot of individuals go towards, or they have that emotional eating, and they're eating those unhealthy foods. So you need to manage your stress, but then you also need to get good sleep. So the reason I bring up exercise for food and mood is because when you exercise, you usually sleep better. Unless you tend to exercise late at night. I have had a couple patients, clients, who like to exercise and then they say that they can't sleep very well. So for some individuals, I would watch the timing of it. Sometimes if it's too late at night, you got that adrenaline going and then you don't sleep as well. Everybody is different. But exercise in general should help you sleep better. There are endorphins that the body produces that makes you feel better. And the other thing is that for most individuals, it is a stress reliever when they exercise. So it really has so many benefits to it. And for exercise can be something as simple as, or physical activity, going for a nice brisk walk. If you have a bicycle at home, dancing around in the house, just getting yourself to move. You have to do something. It really can enhance your mood. Those endorphins, by the way, they last, they say, about 24 hours. So that is why we encourage to exercise most days of the week. And if you see here, it is as good as medication for mood. It helps with brain cell regeneration, brain cell connection, cognitive function. And I tell everybody there are 1440 minutes in the day, 1,440. I'm asking you to move 30. And you don't have to move all at once. If it's 10 minutes in the morning, 10 minutes at night. But think about this. If you did just 10 minutes per day, at the end of the week, that's over an hour of exercise. So I think most individuals can move 10 minutes a day. Now, if you are someone who is limited by hip, knee, back, you have to do it in a chair. Absolutely, there's a lot you can do in the chair as well. They've got foot ergometers that you can purchase. I know there's the QB that's out there. There are a lot of options nowadays, so many options, even if you have limited mobility. Excuse me. So, you are what you eat. Hands down, I cannot stress that enough. I'm sure you've seen some of the commercials for that. They're showing somebody eating French fries and hamburgers and they're exhausted. Of course you are. Just think about it. The reason I bring this up is a lot of times, if you think about a baby, for instance, you want to give them the best food and maybe it's formula or nursing, whatever you're choosing to do, but it's always because you want the best that's for the baby, right? You're no different. It's your body. What you put into that body is really going to impact how it functions, how you sleep, your mood, your overall health. So you have to look at it as food as medicine. Now when I say the downside of this, there's really no downside, but I'm asking you to exercise and maybe move, 30 minutes per day. When we talk about food, food is something that you have to make those decisions many times during the day. So you really have to be prepared to eat healthy. You can't just go in blindly. If you come home from work and you don't have a plan, that's usually when people make bad decisions. Or you don't prepare and take something to work for lunch for you. Or if you're at home and you haven't done any kind of meal planning, it really adds to the stress in your life. And we tend to make not so good choices. We have what we call here SAD, by the way, and it is SAD. It's the Standard American Diet. We have really moved away from a plant-based diet. When I say plant-based, I mean nuts and seeds and whole foods, to one that is really highly processed and high in sugar, fat, and salt. We like quick, convenient foods. There are over 300,000 processed foods on the market, and there are thousands that come out every single year. And that makes it difficult as well because, again, you're bombarded with marketing and what am I supposed to buy? And that's why I stress with everybody you have to really read food labels for that reason. There really is no set point for the amount of sugar and fat that people eat. So what that means is there's like no set point in your brain that says, oh, I've had enough sugar, I've had enough fat, I think I need to stop. There's nothing, everybody is different. It really goes by what you crave, what you like, what you actually, believe it or not, how you, your food habits as a child or as your family when you were a child really shapes your food habits as an adult. Whole food, nutrient-dense diets are consistently associated with lower risks for poor mental health and lower risks for everything else, by the way. Cancer, diabetes, all of those things. 40% of how you feel right now is based on your last meal. So just to show you here, nutrient depletion. We don't eat well, your body does not get what it needs. So there are many different mental health disorders: fatigue, anxiety, depression, irritability, poor mood, all of these things, overeating, sleep disturbance. And then look at nutrient depletion. Now some of you are thinking, well, can I run out and get all of my vitamins and minerals checked? No, there really is no need for that. And honestly, if you are eating a healthy diet that is well balanced, your protein, your good fats, your 5 to 7 servings, bare minimum, of fruits and vegetables per day, your whole grains, you're not going to have that, they're not going to have that nutrient depletion. Now granted, yes, some people might need more B12, vitamin D, things like that, but bottom line is when you're eating processed foods, they are not nutrient-dense foods. They are calorie-dense foods, not nutrient-dense. So signs of nutrient depletion can be anxiety, depression, fatigue, poor mood, and if you look, they're very similar. And why I show this is that not eating well a lot of times can mimic or feel like those mental health disorders, meaning you're not nourishing the body and you're becoming irritable, fatigued, anxiety. So, sugar and your mood. There are brain scans. I used to have this in, but this is a little shortened presentation, but they had the human brain, rat brain, they looked at on cocaine, on sugar. Believe it or not, they showed that it was as addictive as cocaine. It eventually blunts the dopamine response. Now, I don't mean if you're somebody that's going, oh my goodness, I have a couple cookies a day. That's not it. It is individuals that eat or drink a lot of sugar. I have patients or clients that come in drinking 2 liters, sometimes 4 liters a day of pop. A 20 ounce of Pepsi or Coke or any kind of pop, it could be 7-Up, whatever it is, but a regular pop or iced tea even, for instance, 20 ounces is about 67. A Mountain Dew has 80 grams of sugar. They're drinking 2 to 4 liters a day. Those are the individuals that are going to be at risk for this. High sugar has been linked to lower IQ, anxiety, aggression, fatigue, all of these things. It also is a hormone disruptor. The reason is why it's so detrimental, to put it very simply, is the effect that it can have on leptin as well as the effect that it can have on insulin. I tell patients, try to choose foods that are lower in sugar, or clients, sorry. I always say patients or clients because I'm just so used to doing outpatient. Sugar is also what we call neurohormonal. When you eat sugar, you want more of it. I think you've all been there. It actually also can impact your microbiome. This is your second brain, your GI tract, your immune system. Housed in here, all these nerve endings, what goes on in here impacts what's going on up here. These two are connected. And unfortunately, sugar is a disruptor, or can be, to the microbiome. That's the bacteria in your GI tract. You want good bacteria in there. So I tell clients, I say to them, try not to have sugar for breakfast. Don't start your day off with sugar. If you're going to have it, and don't have it right before bed either. If you're going to have something sugary, it could be. I'm not anti-chocolate, or if you want a small cookie, or that's okay. The rest of your day, if 90% of your day is healthy, a little bit of sugar is okay, but have it during the day, during your active hours. That is your best option, and definitely not for breakfast. And blood glucose, fluctuations can impact mood. If you think about it, a third of the population has pre-diabetes. Around 9 to 10% has diabetes. We have 40% of the population where their body's not doing a good job of, I call it the dance. We've got insulin and glucose and blood sugar levels are doing this. So when you are somebody that's eating a lot of sugar, you're going to have more of these fluctuations. You've all been there. Your blood sugar levels are too low. You haven't eaten for hours. You get moody and angry and cranky. When your blood sugar levels are too high, they do exactly the same thing. So that is why I like fiber, I like low sugar foods, lots of fruits and vegetables. They help improve your mood. So grains in your brains. I just bring this up here because a lot of people grains are bad for you. No, they're not. Actually, wheat provides about 80% of the prebiotics in the American diet. Unfortunately, it's just that it's the way we processed and we've grown wheat over the past several decades that has impacted its nutrient density and how healthy it is. But carbohydrates are the main energy source for the brain and the nervous system. You need them to function. You only store about 2 days worth of glucose in the liver and in the muscles. So that is why a majority of the diet is carbohydrates. But again, not all carbs are created equal. I'm not talking about a candy bar carb. I'm talking about fruits and vegetables and sweet potatoes and white potatoes and quinoa, those kind of carbs. Now the reason I bring this up is because a lot of people say, oh my goodness, gluten. There are some studies that show that gluten has been linked to some psychiatric disorders, and I don't want to get too much into it, but I will just say that if you have celiac, if you think you're sensitive to gluten, there's nothing wrong. So celiac is a diagnosed disease. It's about 1% of the population, and it's an autoimmune disease, but only 10% of those individuals know that they have it. But then there's non-celiac gluten sensitivity, and there's really no way to test for it. But if you take out gluten and you replace it with gluten-free products, and your joint pain goes away and your migraines and you feel better and less bloated, it's okay. There's a lot of healthy choices out there that are gluten-free. But my point with that is you don't have to jump on that bandwagon unless you necessarily need it. So just want to talk briefly here, brains on fats. Bottom line is trans fats are toxic and they increase risk for cardiovascular disease, diabetes, obesity, inflammation, cancer. I'm saying the bad fats. Good fats are good for you. They have been associated, these trans fats have been associated with depression, anxiety, memory problems, aggression. They tend to be hidden in fried and convenience foods. Most products now are going to say 0% trans fat, but here's what I tell you to look for. When you're looking at that food label and you look at the ingredient list, you want to look for hydrogenated oils. Anything that says partially hydrogenated is going to be a trans fat. If it is fully hydrogenated, it's more chemically stable, probably not going to be a trans fat. But it can say 0 grams of trans fat if it's under half a gram or less of trans fat in that product. So just because it says 0 grams of trans fat doesn't mean there might be a little bit in there. And by the way, trans fats you'll find in beef and things like that anyway. But that is naturally occurring trans fats versus commercially created trans fats. So not all fats are bad for you. DHA, if you've seen DHA and EPA, those omega-3s, or alpha-linoleic acid, which is like from flaxseed, that's the vegetarian source of those omega-3s. But DHA accounts for about 60% of the dry brain weight, and it is really important for your health, so brain health. Those good fats, especially if you think about little kids and babies, they have a higher fat diet, but also those good fats for brain development and function. So just to briefly, I won't go through all these, but nutrition and psychology are linked, and believe it or not, nutritional psychology really is an emerging field of study. Like they are studying this now. There are programs out there that are nutritional psychology showing that what we eat impacts our behaviors, which I find fascinating. So if you eat less processed foods, right, lean proteins, good fats, a better mood, less depressive symptoms, what we've been talking about. High in those processed foods, the fast food, the junk food, the chips, the stuff you grab at the convenience store or in line or you go through drive-through. Those are associated with depression and a lower mood. Nutritional deficiencies can lead to mental health disorders and cognitive impairment. And then here we already talked about sugar and fat consumption really impacts your cognitive health. I am not anti-saltine and Ritz crackers. I know everybody goes, oh, they taste so good. Sure they do. You're better off with something like a Triscuit, a whole grain cracker. A seeded cracker is better for you. Again, you want things that are not as simple. By the way, I just want to stress here, when I say simple carbs, technically like a saltine cracker is not a simple carbohydrate, if you're looking at the chemical way of defining it. But we loosely use the term as simple carbs are those that are really digested quickly, broken down easily by the body. They don't contain a lot of nutrient, they're not nutrient dense, they don't have a lot of fiber, or they're not really complex. White bread, white rice, things like that. So try to get those out of there. Get the processed foods out of there. Start looking at that food label, getting the trans fat out. Eat less fast food. If you're going through the drive-thru for fast food, if they have whole wheat buns available or whole wheat, that's what you should get. If there is a choice for something that is not breaded and fried, that's what you should get. If there's a baked potato over French fries, that's a better option. A salad. There are things that you can even do that quick takeout food that can still be healthier. Caffeine, and then limit alcohol. Now, caffeine, small amounts is okay, but everybody's body, by the way, handles caffeine differently. But if you have anxiety disorder, you really need to cut down on your caffeine intake because that can exacerbate anxiety and anxiety symptoms. And then limiting alcohol. Alcohol, really, when the body breaks it down, at first it really is kind of depressant. You feel good, but once it metabolizes it, it becomes a stimulant. So if you've had a few too many cocktails, you may have woken up in the middle of the night, feeling kind of panicky, heart racing, impacts blood pressure. So we tell you to limit that alcohol as best you can. So this is the stuff you want to take out. And then you really want to replace it with lean proteins, even eggs and chicken and fish. Looking at nuts and seeds, good omega-3s in there. That's along those lines of healthy fat. Olive oil, avocado oil, lots of vegetables and complex carbs. So instead of using a lot of white pasta with dinner, look at whole wheat pasta, bean, lentil pasta. Try grains like buckwheat and quinoa and millet and oats. They're really all good for you. Again, unfortunately, carbohydrates have gotten a bad rap. And it's not true. Your body needs them, and they really provide a lot of nutrient density, or they're very nutrient dense, and they really can enhance your mood. But choose the better carbs and try not to overdo it. So, in summary, assess your sleep situation. You might be sitting there right now going, "Oh, I don't get enough sleep." If you've got something, an Apple Watch or some other kind of smart watch, you've got a Fitbit, wear it. See how much you're actually sleeping, because that is essential for your health. If you have a CPAP, I cannot stress enough to wear it. If you're sitting there saying, "I do have a CPAP, but I don't use it, it's uncomfortable," contact your physician, provider. Maybe you need to go back and see about different fittings, different settings. It's essential. Not wearing your CPAP increases your risk for sudden death and stroke, sleep apnea. Also obesity, diabetes, so it's essential for you. Manage your stress. If you're somebody that, you are high stress, that's one question I ask all my clients. Stress levels, low, moderate, or high. And then I ask them, how do you manage your stress? Some say they eat, some say they exercise, meditate. You need to find something to help manage your stress, because if you're a stress eater, and you're trying to lose weight and be healthier, and you got a lot of stress, and you're not dealing with the stress, it's just a vicious cycle. And you have to go to the root of everything, which would be your stress levels. Exercise daily, just get moving. Beyond improving glucose levels and cholesterol and everything else, it is good to help with sleep and stress management. And again, assess your diet. Eat 3 meals a day, keep your blood sugars regulated. Remember I said if you have fluctuations in blood sugar, that impacts your mood. Protein and good fats and fiber with every single meal. Get more fiber in your diet. And then bottom line is limit foods that really don't help your mood. So after you've gotten enough fiber in your diet, by the way, if you increase fiber, what's really important is to stay hydrated. So you don't want to increase fiber without increasing or making sure you have adequate fluid. I say 64 ounces a day. There really is no research that shows 8 glasses a day. It really is based on body weight. But for most individuals, 64 to 80 ounces. You might hear things like half your weight. That does depend on the individual. If I have someone that is extreme obesity, I wouldn't tell them to drink half of their body weight in water. So I usually say 64 to 80 ounces. A lot of times patients have a really hard time being consistent with this. So you want to try to stick with this, even if you have to flavor the water some way, somehow. Now, use supplements as needed. Talk to a pharmacist, depending on your medications. Talk with your physician. There are some supplements out there that can help with sleep, stress, but the supplemental industry is not regulated, so you want to make sure you do your homework and talk to a professional that can guide you through that and weed through the information out there. And the bottom line is really limit foods that don't help your mood. So hopefully this helped you. Maybe you're sitting there, you've done an assessment, you don't sleep enough, you're not managing your stress levels, you know you're not making the right choices in your diet. So start with one change that you can make today. Thank you.